The demos earlier in the day that were done by Marissa from Demagi are definitely your gold standard. So as soon as they're posted, please see those. I am just going to cover a few things quickly. I'm not as great as she is at explaining everything, so definitely go look at those webinars once those recordings are available. So I'm just going to hit on the contact tracing side of things and show you some of the changes in the contact monitoring form today. There have been some changes to CommCare that might lead to changes in your workflow in your region. I'm going to stick with just the changes to CommCare because each region does things a little bit differently as to how it affects your workflow or the most current guidance. For some of you who might not have heard, guidance was just changed a few minutes ago, about an hour ago or so. New guidance was released concerning travelers and contacts to a case. So definitely check in with your supervisors to see how any of this impacts your workflows. I'm just going to show you what CommCare does. So to start with, I'm on the contact monitoring form. I will jump around to just those sections of the contact monitoring form that have some changes or updates. So you might see me go through the page quickly, but that's just to get to the spot where there's a change. So starting with on the contact monitoring, we go down to the section that has the case info and the contact info. You'll see there's two new options here to see under case info. What was added was the case's symptom onset date and the case's isolation end date. And so hopefully that helps when you have a household contact that you're following up on. You'll actually be able to see the case that's the household when their isolation end date is, to help especially if an individual is constantly in contact because they're unable to isolate in their household. So that's one new thing. And then as many of you know, last release, we added the option for someone's preferred or chosen name in case their name that they use on a regular basis is different than the name that needs to be used on their health insurance or the time that they registered for a test, or the time that they actually, or the name that somebody else gave you might not be their full name. So there is a spot to add a preferred or chosen name that came out with the last release. So now what we did was we gave the ability to put this preferred chosen name on the quarantine order if that's what the contact would like. So I'm going to just go down now into the quarantine section to show you that change. So under the quarantine details, when it says to send you the email, what email address should the notice be sent to is the same. And then it's going to say, is Nicholas Pearson the name you would like us to include on the notice? Because that's the name up above. And then you're given the option of yes, or you're also given the option of no. And if you click on no, it's going to come up and ask you, what name do you want us to use on the quarantine notice? And so maybe the person would prefer to be called Nick Pearson, or there was a spelling error or anything like that. And so that makes sure that it goes out with the correct name on the quarantine notice. So if it's a no, that they don't want the name that they've already provided, then you can put that on. So that's something that is new. The other item that's new that I'm just going to go up to under the quarantine section is that in the scripting, it does ask, there's a section on what to do if the person's condition worsens if they develop symptoms. And so we changed this second to last bullet here. And so it now corresponds with what is written on the CDC's website. And so it was changed to read if a person has pale gray or blue colored skin, lips, or nail beds, depending on skin tone, as one of those conditions that might, if that worsens, that it might be a sign of emergency and call 911 or get to a hospital. So that's been updated there. And then I'm going to just scroll up to the type of contact. So we added a new type of contact that can be entered in when a case passes on their contacts. They can name this type of contact as group home. And this is to try to help with all those individuals who might be residents of a group home that might get in as contacts that aren't necessarily followed by the VCC. That will help you guys to figure that out, that, you know, this person is part of a group home where that group home might be actually monitoring the quarantine versus VCC, or however it works in your region. So that's a new contact type that was added that you will also then see for this particular person or example. We did put that in as the contact type. So here you can see their contact type is listed as group home. Then the next thing I'm going to show is transferring. So as many of you know, you can, if you're interviewing the individual and they're like, no, I actually live in this county, or I live outside of New York State, and the address section, you can then change that. So say, because I'm in UAT environment, it's harder to do this here, but so say the person is actually out of state, out of country, meaning that they are living outside of New York. So we're going to change the state to actually be North Carolina. It's going to prompt this to say this contact is out of jurisdiction. You'll be prompted in the next section of this form to transfer this contact to the correct jurisdiction. So it's going to continue down and ask the rest of the questions in this section. And then it's going to come down here to saying transfer contact. And it's going to have the information, and it's going to have you add a transfer note, and you'll have the ability to transfer the person to another county or outside of the state. There's a note that's going to just be a reminder here that if it is a New York City resident, to please select the correct county. So you select the county in New York City where the person might live. And so that section now is right there after asking the questions in the demographics section. So that's a good spot to then be able to transfer the record right there, unless you have a different workflows to complete the interview. So always follow your workflows that go on in your region. So those are some of the minor changes that have happened. I'm now going to go on to the more complex, which are the logic that's built into CommCare when the new guidance came out on March 10th for a contact to a case to be able to be exempt from quarantine if they had been vaccinated or if they had tested positive in the previous 90 days. So as this logic is built in for contacts to a case, as of today, we are only monitoring travelers who came in prior to 4/1 or today, April 1st, who are domestic travelers. And then for international travelers, this logic that I'll show you is not in place because they still have to quarantine and have a separate strategy compared to the domestic travelers or the contacts to a case. So we have an individual here, and this record is a contact to a case. So when you get down to the questions, we're going to clear this out. So when you get down to the bottom of the questions here, we have new scripting to share about an individual who might have tested positive in the previous 90 days. So for contact, if the contact tested positive within 90 days of the date of exposure, they may not need to quarantine. The system will alert you if the person does not need to quarantine. The contact is currently under isolation as a case. As I mentioned, they were called already, have an isolation notice, or tested within previous 10 days, then you convert to a PUI. So this is a little bit more difficult one in that it's going to take a little bit of feeling out what the person answers as the question. So here we're going to say, have you already tested positive? And we're going to say, yes, this individual tested positive. And they tested positive back in February. So we're going to go in and we're going to add the date of February 10th. So now it comes up to say, if this contact traveler tested positive in the previous 10 days, it is recommended you convert the contact traveler to a suspected case PUI. You can do so at the bottom of this form. And this is because if they had tested positive in the previous 10 days, and that's the date you're providing, they should be followed as a case. And so then you would transfer this record to PUI to be merged with their case record. And the new questions that come up is the name of the testing site and the location. So we're going to put in the UAlbany testing site, and the location is in Albany, New York. So now, because I've filled in this information, as you scroll down the record, after the symptoms question, we're going to mark this person had no symptoms. Because to be exempt from quarantine, you have to be asymptomatic as well as meet the other guidance. And then there's two scriptings down here that based on the information, you would need to know what to do. So here it says this individual has tested positive within 90 days prior to exposure date. This individual meets criteria for exclusion from quarantine. That is a message that CommCare is saying based off of the calculation of when the person tested positive and when the person's exposure date was. So there's two sets of scripts up here based off of what the logic will tell you, or if you use the Excel calculator to look at it as well. And it'll say, here, no quarantine is needed based on vaccination or previous positive test result. So the script is this, you would say, is based on what you told me, you do not need to quarantine. The scripting is very basic in here because at the time we were looking at information as to like what would end up happening. Always refer to the actual process for your next steps for the verification to what is being done in your region. But this is what CommCare will do is it's going to come up and it's going to say you whether or not a person meets the exclusions, and there's going to be scripting here in CommCare. And so if you have a verification process, things like that, follow what your guidance is for your region and check in with your supervisor if you have questions. So you'll also notice on the form, if you scroll down, that the status section will also have additional questions here. This is for when the time, at the point in time when the individual gets verified, they can go down here and the person who does the verification can say, yes, we verified that the result was within 90 days. And then there's the option that the lab, after the lab result has been validated, would you like to close the contact? As well as another note saying if it's been within 10 days, recommend you convert to PUI for monitoring. Now, depending on your region's workflows, who does this step here might be different, but you do have the ability to close the contact right here on this page, and it will be closed as they're exempt from quarantine because their positive lab result within 90 days. So next I'm going to go up and show if a person states that they were vaccinated. So hang on one moment, and I'm just going to clear out. So you're going through the interview, and you get to the questions about vaccine. And so here is the scripting that's going to come in for all contacts except travelers. And so that's a note up to here to you. And then here's some additional notes that you have them about the contact received the vaccine, ask them to review their vaccination card for the remaining questions that are on here, and it'll alert you as usual. And then it also has some information about the exposure date and the calculations. You guys can go into the training environment and take a look, or go through production as well. So it's going to ask you, have you received the COVID-19 vaccine? I'm going to say yes, this person has. The first dose, I'm going to say, was back in February. And they've also gotten their second dose.
Good.
And because you put in both the first and the second dose, and you've got the symptoms are none, after the symptom question is going to be your scripting, and it's going to be your logic that comes up from the system. It's going to say, based on responses to vaccination questions, this individual meets criteria for exclusion from quarantine, and you have the same scripting that you can then use to figure out what to say. If you are using different scripting in your region, please refer to your region's workflow. And then if you scroll down to the status section, it's going to now ask if the vaccination was verified, and if the vaccination information has been validated, would you like to close the contact? and it's going to close the contact. So next, I'm going to just show you what this system will look like if the person doesn't qualify for an exemption. So say the person only has 1 dose and they never went back in to get their second dose. So we're just going to put in 1 dose. And if they don't have any symptoms, it's going to come up here and it's going to not have any logic on here at all because the person does not qualify for an exemption. So you won't see any message here, and then that's when you know that they need to go through the rest of the interview and continue on with the information that you gather from an interview. Likewise, if they actually did qualify for but they said that they had symptoms, then when you come down to this section, you will not see a notice here, meaning they are not, they do not qualify for an exemption and they need to go through and do the full interview. So those are the new logic and new questions associated with the logic. I'm now going to go out and find an international traveler contact so I can show you guys what that looks like for an international traveler. So we'll go into the contact monitoring form. And because an individual is an international traveler, they're not eligible for an exemption from quarantine due to vaccine or positive test. So when you come down to the vaccine section, it's going to say there's going to be scripting. And it's going to say, I'm going to ask you if you have received a vaccine for COVID-19. Even if you are fully vaccinated, you are not eligible for an exemption for quarantine due to traveling internationally. Then it's going to come up with a message to say if an international traveler received the vaccine, collect the necessary information. Vaccination does not exempt an international traveler from quarantine. They must still follow all guidance for quarantine and/or testing. Check with your supervisor for the latest guidance. We are going to change that last sentence and put in the full list of what the 2 qualifications are for an international traveler, and that is they can either do the full 10-day quarantine or they can get tested on days 3 to 5 after arrival into the U.S. And if it's negative, they can be released on the 7th day. So we don't have any questions about that specifically because we have to ask the same questions for all contacts, whether they are a traveler, whether they are an international traveler, domestic traveler, or if they are a contact to a case. So these questions are going to be the same. There's nothing going to be specific to international travelers. You can use the notes section to capture information about if they are doing the test out strategy. When it comes to adding a vaccine, if it's somebody who comes from another country, they could have been vaccinated in that country with a vaccine that is not on our list here. We only have those 3 vaccines that are listed as approval for use in the U.S., but there are other vaccines out there that are used in other countries. If they got a different one that's not on our list, you can check other, and you can go in and specify the manufacturer, and you can put the information in that way. If you end up talking to somebody who says that they didn't actually travel outside of the country and they only traveled within the United States from this day forward, so April 1st on, you can close those records as registered in error because we won't be following any people who come into U.S. or we're just, not U.S., but we're traveling within the U.S. They're no longer being monitored starting today. So any records for anyone who came into New York starting today can be closed as registered as error because they should not be coming into CommCare at all anymore. We will still be uploading international travelers who fill out the electronic traveler form, and there's always a chance that one of a domestic traveler gets mixed in with the international travelers depending on how they fill out the form. So I think that's everything, Margie and Piper, that I wanted to go over. I have a few minutes I can stick around for some questions if there are any specific questions in the Q&A.
I think we do have some questions. I see Piper was able to join us as well. Welcome, Piper. Glad to have you back.
Thanks, Margie. Good to be here. I'm just catching up on questions, so if you have some, go right ahead.
Okay, we do have a couple of questions in the chat. Please do remember to place your questions in the Q&A box instead of the chat, simply because not all the panelists have access to your questions, and we want them all to be answered. So first question we have is asking if the person qualifies for exemption, do we go ahead and tell them that, or we still put them through the workflow? And I think that you've already answered that, Amy. We're still following their regional workflow that they're using unless they've been verified. Is that correct?
That's correct. I'm just showing you that we put the logic into the system that previously we referred to the calculator to calculate if it's within the correct time frame. It still needs to be validated to ensure that the dates provided are actually true dates that they were vaccinated or that they had a positive test previously.
Thank you. And we also,
yeah.
Oh, no, so go ahead. Go ahead. Sorry.
I was just going to add that we now have questions so that we can document that that verification has been complete. And so those are the new questions at the bottom of the form under status that will only come up if the person is actually eligible for exemption. So right now they're not eligible for exemption, but if you go in and you have somebody who is eligible for exemption, those two new questions will come up. And that's for the individual who's doing the verification to complete those questions.
Perfect. And we do also have a question from Alexia who's asking, can you repeat what you said about the workflow for domestic versus international travelers?
So starting either tonight or tomorrow night, international travelers only will be uploaded into the system from the electronic traveler form. So the traveler form is still being requested that all people who travel outside of New York State complete, but only those who complete that with an international travel are going to be uploaded into CommCare. So the traveler object should only show international travelers being uploaded new starting either tonight or tomorrow night once they have that process ready. And I can actually bring up what it looks like as well, because we do not have a lot of international travelers, so some of you might not have seen this yet this morning. So the specific scripting is under the vaccination question here.
Great. And Piper, do you see any related questions in the Q&A field?
I do see one about vaccines, which could apply to travelers or domestic or non-travelers. Someone was wondering what happens when you select Johnson & Johnson for the vaccine. Does it give you 2 doses? Does it give you just the one? So I was wondering if you could demonstrate that real quick, Amy.
Sure. So this actually was in for the last release in March 10th. If you pick the Johnson & Johnson vaccine, it's going to come up and ask you for the date, the location, and the lot number, and that's it. And it's going straight into the symptom question. So that question that says, have you received your second dose? That's not even going to show if you pick Johnson & Johnson. So if this person had Pfizer on that date, this question comes up saying, have you received your second dose? So that's just not going to show when you pick Johnson & Johnson.
I'm okay. I don't understand why you couldn't get into the meeting when I sent you the meeting at 1:30.
Can everyone be sure they've muted themselves? We're getting
until 2 o'clock. I don't understand why you couldn't get in.
Yeah, I think we have somebody who's called in to the forum who is on another call. So if you could be sure that you've muted yourself. Thank you very much. All right. Any other questions regarding the release changes before we move on?
And I do want to let everyone know that we will have some guidance posted to updated guidance posted to CT support shortly that will incorporate these new rules that just took this new guidance that just took effect today that removes that 90-day the 90 days from the quarantine and vaccination. So we're working on documentation that'll be posted very soon to CT support.
Okay, great. So if we don't have any other questions regarding the release changes, I think we're ready to move on to our next theme, our next topic. What do you think, Piper?
Absolutely, Margie. I think Corliss is up next, right?
She sure is. So we're going to have, we'll give presenter rights. Do I need to do that, or do you have charge of things again? I'm not. I left to do it. Okay.
Yeah, go ahead, Margie. I left you as host for right now, so yes.
Okay. It took me a minute to figure out how to do it in the beginning. I've got it down to a science now, so. All right. So Corliss is going to be talking today about, let me see, triggering the hubs in the contact monitoring form. Please remember that she's going to be demonstrating how to do these, do the triggering of the hubs in CommCare. Remember that any process questions that you have may vary by the region that you're in. So you'll need to refer to your supervisor for any questions about why you would do something or when you would do something, but Corliss can show you how to do it when it's needed.
Hi, good afternoon, everyone. I am going to share my screen. Let me know when you can see my screen.
I can see your screen.
Okay, however, I have CommCare open, but I can't. Is there any way I can get rid of this here so that I can go to CommCare? I had it.
Yes, you can go ahead and
here.
close that tab, Corliss, that's open that says, thank you for using Cisco WebEx. Great, looks perfect.
Okay. All righties. No, this still hasn't closed. Well, if I click this, it will stop sharing. Is that correct?
Correct. If you click the bottom of the screen and stop sharing, it will stop sharing for a minute. We're still sharing right now, though.
Okay. I was just trying to get this black menu bar that keeps coming down. Okay, so let's move forward. I will champion through it. So today I'm going to be presenting to you, as Margie mentioned, how to trigger different hubs. Now, Amy was very complete in what she was presenting, and actually presented some of the different hubs that I was going to review with you. So rather than be repetitive, I will just get those portions and move on to those that were not covered. So of course we know that when we are in CommCare and we are conducting an interview with the contact, depending on the contact's responses and the options that you select in CommCare, there are going to be other sections that open up, a series of questions that may open up, and as well different hubs that will open up. So as we go through the template, I'm just going to go through it and go through the ones that will present another series of questions or produce another hub. Now, as Amy had mentioned already, if you had asked the contact if they'd been tested and they said that they were, if you choose yes, as she presented previously, you will see that first, let me say, anytime you see those circular arrows rotating, you know that one or two things are happening. Number one, either the information that you've just put into CommCare is loading and saving within that file, or it's going to produce another series of questions. So as I always say, is whenever you don't be so quick to scroll through to get to the next question, especially the newer tracers, you're kind of anxious to get through the interview, but do take your time and look for those circular arrows, because it does in fact mean that other questions could be populating, and you don't want to scroll too fast and then miss asking important questions that need to be asked, such as this, if a person had tested positive. So as I said, Amy has already covered that, but I just wanted to make that statement. As you scroll down, you get to living situation. Now, this is kind of self-explanatory. If you choose this, I don't believe there are no other hubs that are going to open up if you choose either of those options. However, when you get to the status section and occupation, that can open up other hubs. So for instance, if you're talking with a contact and that contact states that they either work for or attend any type of school or child care services, and you select that, as you see, there's those arrows circulating again, it is going to populate the school hub, which will be further down in the interview. And here it does indicate that the school details will be collected below. Okay, so we're going to be going back and forth because I want you to see this as I've selected it. So as you see here, this section has populated, which was not here before: child care, school, college details. So whether you chose school setting because the person worked there or attended, or even if you chose childcare because you could be calling with regards to a minor and speaking to the minor's parent or guardian, and that person then states that the child could be 2 years old and be in childcare, that also would apply. Okay, even though we selected school, if you select childcare, the same hub is going to open up. Okay, the same section. So when the section does populate, these are questions that are important that you're going to have to ask. You must find out the type of school setting that the person either works in or attends. And that could be anywhere, as you see, from childcare to pre-K to college, university, or higher education. Now, as well, if you are in that same section where they ask for occupation, sorry. If you chose, for instance, healthcare worker, as you see, those arrows are circulating, which means that there are other questions that are going to populate because you selected healthcare worker. Facility details, again, will be collected below. So as you are...
Where I was this, you just press this and look. It shows you...
I'm sorry, I'm hearing someone talk.
Great.
Okay.
No.
Okay, so as you choose healthcare, as you see, this healthcare facility details has populated. So during the course of your interview, you're going to have to ask this series of questions. And it also tells you this section opened because either the occupation as a healthcare worker or the relationship to confirmed case is a healthcare worker. Okay, and these are the type of workplace facilities and you will ask which type of facility they either that they work in. You will select whichever one that they state, and as you see, again, there are those circular arrows, and then you must get the name of the healthcare facility. If the healthcare, there is a drop down here. If the healthcare facility is not already pre-populated in here, and we do have quite an extensive list in there, you will choose other. And as you see, if you choose other, because it's not, the information is not already stored in the CommCare system, you're going to have to ask this series of questions where you must get the healthcare facility name, and you can say Smithtown Hospital. And you'll have to get the healthcare facility address, 1800 Old Country Road, the facility's phone number. Okay. And in the event that there are times when people work at not just one healthcare facility, but they may work at one place in during the day and one place during the night, or vice versa, or they could just go visit different facilities because that is their job. In that event, you do have the option to add another healthcare facility. Again, you see the arrows, and then this opens up, in which case you will have to ask the contact these questions. In what capacity was the contact at the facility? Were they visiting? They could have been visiting a relative or a friend at a facility. So let's, for instance, just say visit. Then the type of healthcare facility they visited. Well, we visited grandma who's in a long-term care facility, unfortunately. So we're going to select that. Then you're going to have to get the healthcare facility name. Again, when you click the down arrow, if the facility is not listed, and again, we have quite an extensive list of facilities here throughout Long Island. If it is not there, you will select other. Then again, you'll have to get the same information you received for the other that you obtained from the contact. For this first facility, you will have to get again. So what is the other healthcare facility name? We can say Oakdale Rehab, which is at 171 Ingram Boulevard. And the phone number there is 666-333-1212. Okay, now you have completed this, unless by chance they happen to be in or have visited yet another healthcare facility. But in the event of any of that happening, this is how you would complete that section of the template of the interview. So let's go with a school setting, because those are top priority whenever you are working in the PCG hub. So we're going to do school setting, and we're going to continue through the interview and see what else is there for us to open up. Now, Amy, again, was very thorough in her presentation. She's already presented to you what happens when you select yes to the vaccine and how to navigate through that. So I will not repeat that. But next we have the symptoms. So I'm just going to say that this particular contact had a few symptoms, unfortunately. And again, we're going to wait for that to come to a check, which populates another question. What was the first date of onset for these symptoms? And which time, if you click in here, you can choose the date. Okay. If they say 2 days ago, or, I think it was a couple of, try to help them and trigger their memory. Well, you said it was a couple of days ago. We're only asking about the past 3 days. So just think about anything that you may have experienced between Monday and today. Okay, so once they've pinpointed that, you can select that date and continue on. Again, Amy has already covered this portion of it. So you would follow the script in accordance with the response that the contact gave you, as well as whatever your regional workflow and directives are with regard to that section. Okay. And then we're going to continue on. Now, again, here, just as with occupation, with type of contact, if you were to choose that, if you were to choose healthcare or school setting, again, you would get questions that would populate. Okay, so if the type of contact was a workplace contact, as you see these questions populated, and then you would have to ask your contact these questions. Okay, were they aware that they were exposed? What was the last date of contact? And were they in close proximity to the case? Okay, but we have already said this was a household, so we're going to leave that as that. Describe your contact with the known case of COVID-19. Again, we're going to choose a school setting. Now, what that did was trigger this hub, okay? The person worked at a school, their contact, describe their contact with the known case of COVID-19, that was at a school, that triggers this school hub, the school section, I should say. So here you would ask these questions, choose accordingly. We're going to say a college, university. Now, here are additional questions have populated because of the response that we chose. So you would then ask your contact this series of questions. What is the name of the university? Just as you did with the medical information, you would click on the down arrow. They have a plethora of options in here for universities. We will just say Berkeley because I'm familiar with that, and that's where my eye went. So once you select the university, as you see, the address will populate, and you will then have to ask the contact, when was the last date that they were in that they were at or attended that university? Okay, whether they taught or whether they were a student, because should this person become symptomatic and possibly be positive, we want to know when the last day they were in school according to their exposure date or their positive test date, so that they can better gauge who may or may not have been exposed to this person. So let's say their last date of contact was, let's say, we're going to say March 29th. That's the last date that they were at that location. And then you will have to ask the contact whether they're a student, staff member, faculty member, teacher, volunteer, or visitor. We're going to make this person a teacher. And then you'll ask them if they attend online, if they are in person, or a hybrid. And you will choose and select the respective answer. Now, once you've done that, as you just seen, there are other questions that populate where you must also find out if the person is attending in person or hybrid, which is why I chose this. How did the contact get to school? We want to know how they traveled to school. Again, if this person becomes symptomatic and they become COVID positive, we want to know how they get to school. If they are driving to school with a friend or neighbor, we need to know that so that we know who else might possibly have been around this person. Okay. Or if they were on the school bus, then, and this person became positive. When was the last day they was on that school bus because of the last date of attendance, which will give eventually, as they investigate, they will give them an idea of what day they were on the school bus, what other children were on that school bus, and what other children could have possibly been exposed. Okay, and then we're going to continue to go through the template. Now, self-isolation. This populated because we gave this person symptoms. If the person has no symptoms, then this section here will not populate. So when they have symptoms, you must ask them this series of questions, which are vitally important. You want to find out if this person, you want to let them know that because they're experiencing symptoms, that it's important that they isolate for 10 days. And you're letting them know what it requires. They must not share a bedroom, bathroom, common spaces, or they should disinfect the spaces after each and every single use. Then you want to find out, are they able to isolate themselves at home? They could be in an apartment with only 2 bedrooms and they sleep with their husband and their children have the other bedroom, and then they have Uncle Bobby sleeping on the couch. Where's this person going to isolate? That's why this question is very important with regards to a symptomatic person. So if the person is able to isolate, then you're going to ask them this question. If contact has already started isolating, you're going to enter their isolation start date. So you would then ask them if they, when they started feeling the symptoms, if they, thought ahead and began to isolate themselves, or at least try to, okay? If in fact they say no, you want to find out what is preventing them from self-isolating. As I said, if this person is in that 2-bedroom apartment and the couch and the bedrooms are taken, they're not going to have any place to safely isolate and protect the other people in their household. So you want to talk this through with them, and you want to put a complete and detailed response in this free response box, okay? Then you're going to ask them if they need any additional help with food, medical, or mental health or social services. And actually, this is a confirmation because in this very important part of the quarantine requirements, when you review this with your contact, this question precedes that section that we just left, okay? Here is the main part of the interview where you're gonna find out if they have any, if they need any supplies, if they have the resources that they need, meaning cleaning supplies, masks, working thermometers, if they have enough food to last, do they need any pet supplies or anyone to help take care of their pets, etc. Maybe grandma lives with them, or Uncle Charlie who's sleeping on the couch is there because he has, they take care of him. Whatever the issue, this is the beginning of where you're going to find this information out, right? And before you offer CSS services, which is what this is leading to, you're going to help them figure out if there's any other resources that they can use with regard to helping them out. Sometimes when you're calling contacts, they're, so focused on the fact that they've been exposed that they're not thinking clearly. So you want to help them think it out. Well, you mentioned you had 2 other people in the household. Is it possible that one of them can assist you and run these errands for you to help get you the food and supplies that you need? Or perhaps you have a family member, a neighbor, or a friend that lives close that can run these errands for you. Now, in the event that it's no to all of the above, here it's kind of a reconfirming. Okay, again, you mentioned you needed help with, etc., etc. So I just want to confirm that you need additional help with food or any other medical, mental health, or social services. Here you will select yes. When you select yes, this free response box opens up. You are going to be very specific in what you put in this box, meaning if a contact tells you that they don't have food, well, can you please elaborate on that, ma'am? Do you have at least 1 or 2 days of food in the household? Do you have enough food to last you until the end of your isolation and or quarantine? You want to get the specifics, okay? And you want to type them out in this free response box. Now, because you selected that, and I'm going to show you again so you can see that when that's not selected, that CSS hub disappeared. When you select yes, you can see that it reappears. Now, anytime you see something that says hub, which is why I tried to distinct earlier the difference between stating this hub opening and the section opening, because there is a difference. This hub, anytime you see a hub, as you see this says Community Support Specialist Hub, meaning this section here, this hub, is for the community support specialist to complete, not the contact tracer. And here it explains to you why this hub opened up. The hub is triggered because you said yes up here. So the only thing that you as the contact tracer is to do or are to do in this section is for the status select pending, because the needs that this person has, all of them are pending until this contact file actually gets to a community support specialist. And right now it's not there yet because you're still working on the file. So that is the only section here or question here that you have any activity in, other than, is this a high priority referral? You must be very particular in clicking yes to high priority referral. High priority referral would not be someone that, they may need food, but they have enough food for at least a week. Okay. High priority referral is someone that has either no food or 1 or 2 days worth of food, someone that's on medication that they need every day. They have no way to get it delivered. They have no one to run the errand for them. And they have no other resources, but this is a vital medication that they take every day. Someone who has a baby, and that baby, they were going to go out to get that baby formula and Pampers today, but now that we've called them and we've let them know that they must isolate, they cannot go. That is a high priority referral. Okay, so then you would select yes here. Now, this school hub opened up because if you recall, this person attended school. Again, anytime you see hub, school hub, this is for a school specialist to follow up on, not for the contact tracer. I remember when I first started out, for some reason, I'd forgotten that on my first couple of calls, and I was literally answering these questions. But these are not for the tracer to answer. This is for the school specialist. Again, the only thing you will do here is select pending. And the school specialist will take care of that part of the contact record. And then the only other thing here is toward the end of your interview, one of the things that you want to be a result in this is that you want the person, even though they have symptoms, you want them to register to receive the SMS text message service that we have, so that starting the next day, they can be followed up during the course of their quarantine period. Because the person has symptoms, it doesn't mean that they have COVID-19. They could have COVID-19-like symptoms. That is the purpose of converting, one of the points of converting to PUI. Okay, so if this person decides or that they want to sign up to receive these SMS text messages, you will select yes. This question will populate. You will confirm the phone number that they want to receive SMS texts in. Do not assume that because the number is in the system and this is a cell phone that you can automatically click yes. There is a possibility that this could be a work cell phone number that's in our system. Just because you call them there doesn't mean they want COVID-19 checkup texts coming to their work cell phone. So always repeat the number and confirm. If it is not, because this is this person's work cell phone, you will select no. These questions will populate. You will then ask them what number they'd like to receive the text on. You will input that number in the space provided, and it will automatically populate. And then the text will go to this cell number as opposed to the one that was already in the system. Other than that, though, those are the only hubs or further questions that will populate as you're going through your interview. And of course, once you have a person reports symptoms, you must convert them to PUI. Sometimes people think that converting to PUI means the person has COVID-19. It does not. It just means that the person has symptoms and you are converting them to a person under investigation, okay? Which means it goes to a case investigator who will work with them and come to the conclusion of whether they are actually COVID-19 positive or not. But you will select yes, convert to PUI unless the person has CSS needs, in which case this person did. So one of the only times you will not convert to PUI is when a person has CSS requirements, and you will select no. You will annotate in your copious way of writing notes, very detailed, and then CSS will convert them to PUI. So that is the end of this presentation.
Excellent. Thank you very much, Corliss. You did a great job.
Thank you. So I'm not sure if we have time for questions or not.
I think we are at 3:02. What do you think,
Yes.
Piper? You think it's time to call it a forum? And we've got lots of answers here. I know that we'll be posting this recording on the CT support site as well, so people can refer back to it after.
That's just what I was going to say, Margie. We answered so many questions today. As usual, we did stay away from policy related questions. Remember, what we showed you here today may differ slightly from your region's workflow or guidance. So please follow your region's workflow or guidance if you have questions about what you saw today. That would be my only tip there. And this will be posted to CT support probably by tomorrow, I want to say, maybe sooner. We'll get it up as soon as we can for everyone. And with that, I wanted to echo what Margie said. Thank you, Corliss, for a fabulous presentation. I believe some of our other presenters have dropped off, but I wanted to thank Amy. I wanted to thank all of our wonderful panelists answering questions. Kristen and Hannah and Lisa Ryan was in there too. So thank you all so much for being here today.
Thank you. Have a great day.
Okay, have a great day, everyone.